Hello everyone, I'm Dr. Jennifer Chen and welcome to my channel. Today we're going to talk about the preparation of OET exam speaking component. Before I start today's talk, let me give you a brief introduction about myself. I'm a board-certified physician with about 20 years of clinical experience. I'm board-certified in internal medicine and geriatrics. I was a clinical faculty at UTESCA and PNWU Health Science. I had a lot of experience in medical education. Now, after reviewing the OET exam instructions, manuals, and test questions, I think I'm qualified to be called a self-trained OET specialist. Okay, let's go back to today's topic. How to prepare for OET exam speaking component. Tip number 1 is to read the instructions carefully. If you have watched my videos for a while, I know what you're going to say. Not again, right? This tip is just way too simple, way too basic. Isn't that what you're thinking right now? But trust me, I see a lot of candidates who are not really reading the instructions carefully. So before you start the test, you will be given an instruction card, which will give you step-by-step questions, prompts about what you're supposed to talk about. So read about those instructions carefully. Use your 3 minutes wisely. And have an outline in your mind. Think about what you are going to say when you are in the real test. Tip number 2 is to create your own vignettes. I recommend this practice from the beginning when you were trying to prepare for the test. Write down what you want to say for each occasion. For example, for greetings, what are you going to say? Good morning, good afternoon, I'm Dr. So-and-so, and how can I help you today? To explore the patient's symptoms, which questions are you going to ask? And a lot of the times, the instructions ask you to explain the diagnosis. How are you going to say it? And about certain treatments, antibiotics, medications, how are you going to explain them? Also, there's a tough one about resolving disagreements with the patients. What if the patients just have doubts? Patient is anxious, keep asking you questions, doubt your decision. What are you going to say? And then also closing. When in the end, what do you normally say? Just make it a pattern. Like you always say, okay, do you have any questions? And if you have any questions, this is the phone number you can call and we're always here to help. Things like that. You can create your own signature closing. So once you have developed your own vignettes and then you decided what you are going to say exactly for those occasions, then during the real test, you only need to fill in the blanks. For example, for the explanation of treatment, you have already decided you're going to say Mr., Mrs., so-and-so. For your symptoms, for your condition, I need to give you a medication called blah, blah, blah. And then during the test, you just fill it in. So during the real test, you don't have to keep thinking what you're going to say. You already know what to say. You have a pattern. You just need to fill in the blanks. Tip number 3, I think it's very important, is don't start every encounter from the beginning. That's another mistake I see a lot of candidates make. A lot of candidates pretend they don't know what's going on with the patient when they start the conversation. Sometimes it's the correct thing to do because you're supposed to explore the patient's symptoms. But a lot of the times, the instructions already told you the patient already had blood tests, already had a diagnosis made, so they're there for a certain reason. in that case, you should not start the encounter from the beginning about, oh, tell me about your symptoms. Tell me how you're doing. That's why I also said the number one tip is to read the instructions carefully. Tip number 4, show empathy by addressing the patient's questions. A lot of the times, the instructions will say, show your concern, show your empathy. I think a lot of candidates actually struggle on this issue because they're not sure how to show empathy. So I hear you guys repetitively saying, I'm sorry to hear that. I can understand. Okay, I see. And some candidates think if you just keep saying these words, that means you're showing empathy. I would actually recommend you to address the patient's concern directly. As long as you show the patient that you have heard what he or she is saying, you understand what he or she is concerned about, they understand, they know that you have empathy for them. And sometimes I hear candidates just keep saying all these words, but not really addressing their needs. Then I think for the patient, they will actually feel like their needs were ignored, and they won't feel the empathy or the concern that you are trying to show. So my suggestion is, during the conversation, try your best to figure out what is his or her concern. Why is he or she against the treatment? Why is he or she afraid? Why is he or she being anxious? Also, does he or she have more questions that need to be answered? After you figure things out and you have a specific answer for their question or concern, then they will really know that you do care and you are showing empathy that way. Tip number 5, avoid saying the words you cannot pronounce clearly. So now try to pronounce these words: palpitations, precipitated, exacerbates, consequences. These are long words that are pretty hard to pronounce if you're not really familiar with them. So when you're reading the instructions and when you see those long words, you already know you will have trouble pronouncing all those words correctly or clearly. Then my suggestion is to just find some simpler words to say. So that way it will decrease your level of anxiety, and also it will avoid points deductions for pronunciation. Now let's talk about tip number 6. That is practice, practice, practice. You might feel awkward or weird when you say something the first time, but after you say it 10, 15, 20 times, you don't even have to think about it. Then it becomes natural to you. So when you're doing your practice, just remember the steps we talked about. So identify the vignettes. Think carefully what you are going to say. Then avoid the things you cannot say well. Then keep practicing. Tip number 7, you need to realize it's a test for English and communication, not a test for medical knowledge. So if you don't know what the disease is about, what the medication is about, it's okay. Nobody is testing you on that. I see a lot of candidates getting very anxious when they see a case, a diagnosis that they have never seen before. Then they automatically think, well, I cannot do it. So you need to realize all the information, all the bullet points, all the things you need to say are in the instructions already. So you just have to say it. Say it clearly and make sure you can communicate well. And our last tip for the day is, nobody is going to die today, so relax and smile. I see some candidates during their practice, they really try their best to convince the patient. They want to convince the patient to do certain things like take a medicine or doing certain tests, and they won't take no for an answer. During the conversation, they can come across as pretty harsh or sometimes even critical. So what I want to point out here is, even if the patient doesn't take your advice, even if he decides to make some unwise decisions, nobody's going to die. He's not going to have a bad complication. He's not going to pass out in your office. So it's not your job to convince him to do the right thing. Your job is just to say all the things you're supposed to say and say it clearly and communicate well. So if in the end the patient says, I just don't want to do it, I don't feel comfortable doing it, it's okay. Yeah, you can still politely say, okay, I can understand. So just relax and smile and just say the things you need to say. Okay, that's all for today's video. If you find today's content useful, please do subscribe, share, like, and comment. Have a great day, and I will see you next time. Bye!